not in the middle of addressing your glove here and exposing your hand and your skin. So you look at the expiry date, you look at signs if there's breakage or compromise to the glove, right? And you look for the type. Some persons are allergic to latex. Unfortunately, sometimes latex rather. Sometimes you're not going to find out until you actually put on the glove. So some persons have to actually bring their own, source their own, and come to work with it. Because you're allergic, because this is mostly what is being administered in the hospital. So if you're allergic to it, then you have to source your own. Alright? Then after that, so this is how it looks. So how you know, you have to wash your hands as usual, you know that. Then there's an area here where they say peel open at corners. So I don't want people to be doing this. Peel open. Some of us, don't kind of read a lot. So ensure that you read, because we're not supposed to tell you the technique to it. All right. So we peel. That people? Alright, you see that? When you open the glove now, you'll see where it has left cuff, right cuff. So not to confuse you which hand to start with first. So you normally start with your dominant hand, which will be right. You see how I'm opening the glove? Corners here are already prepared, so this is where you touch. If you touch the glove accidentally by your bare hands, you know that you have to start over. It's not sterile in any way. Thank you so much. Alright? Alright. So you have the gloves open here.
Come here.
Come here. I don't think we're that hot. Alright, so most of the time when you do the dressing, you can have this hand. Alright, so the right hand, so what you do, you take the left hand to your right glove, right? See how I position my hands, class? Ready to insert my hands. See?
Above your waist.
Right. Once you start, right, should be above your waist. See that?
Mm-hmm.
Next one, no, you can't do this. Totally defeat the purpose, right? So you take the hand that you have done and you put it under this one.
Because
see that?
That one is sterile, so you can.
Exactly, thank you so much. Then,
You're supposed to drop this.
right? When you do this now, you can shake down and fix, right? But remember, you can't do it with your bare hands. Everybody get it?
Yes, miss.
Wonderful. And the way we duff is the same way that you were taught when we were doing PPE, duffing and dunning, right?
Okay.
No different. So when you're finished, you just pinch, right? Discard. Get it?
Yes, miss.
Right. So remember, once you even suspect that you have compromised your gloves, you
Throw it
cannot move on.
So you throw it away, miss?
Yes, nurse.
Wash your hands.
And wash your hands and restart. Everybody get it?
Yes, miss.
Awesome.
All right, wonderful. Now you're gonna get some opportunities to practice. But before you practice, just be ready. Let me do one more thing. Because I want you to practice both things one time. All right. What I'm gonna do now, as you see here, this is your trolley. Prepare and know what you need for the first thing. You need a dressing set. But before you start, you have to clean the trolley, right? You take up your glove. You don't have to use a sterile glove to clean. Based on the institution policy, they have what they need or what you should clean with. Some institutions clean with alcohol, some with Savlon, some with bleach and water, some with soap and rag. So determine what your institution. It's no standardized thing. Depends on where you work. Everybody get that?
Yes.
So for this hospital, we're going to be using alcohol. Yes. So normally, remember, I don't have the spray thing. Right, because we normally spray now and we spray this. So what I'm going to do, I'm going to spray the pour the alcohol on the surface, alright? I'm giving you the visual picture, alright? I don't want anything less. Alright, so how you wipe is one wipe. One direction, right? So what I normally start with is just not to forget them. If your trolley has rails and so on, you wipe those first. And you wipe clockwise, right? Right. And then you go to the center. Just not to forget them, because sometimes when you finish wipe the top, you don't remember that you should wipe here. Alright? So I'll put here another one because I can't show the alcohol on the rail. So I have to prepare it separately. So like this now, you're gonna wipe. Right? You see that?
So you're not to go back to take
Right, so and you discard. Discard. So it takes a little while to finish. Alright? I'm not going to use alcohol for all that. I don't want to finish my little alcohol. Exactly. And then, when you wipe, remember that it will dry by air and so on. So you wipe. One wipe. Next one. Right? Yes, please. Yeah, use different paper. Don't miss. If you don't. Right? Right? Then, when you reach here, you have to go down to the bottom shelf, right? But you still have to wipe the. So you have to stoop. Those are tight skirts, yes. Those next one. One wipe.
You guys know what she has to pay.
One wipe. And you clean. Alright. Takes a while. So this takes you see how this takes a little time, right? So it will dry eventually with it dry, right? Some persons have to actually go down as slow as the wheels. So we just clean the entire trolley. Right? Let me just. Right? Okay, wonderful. Now you have this a very clean trolley, right?
Is it possible if you put it outside and hold it on?
Remember this trolley will be on the ward, you know. On the ward. So you have to clean it. So it's stationed in the ward, so it's not somewhere where you can carry outside. No. I have to clean with the alcohol, not just water. Yes, it's hard work. So by the time you finish clean, ladies, wash your hands, come back, it will dry, and then you can just put your dressing set on top. Alright? Everybody getting it? Yes, it's a tiring procedure, but you have to do it. Alright, so this is the only thing that should be on the top of the trolley. Alright? You used to have the one with the 3 layers, but don't have it in the no. Then, what you can also do, you know you're gonna need gauze, but when you go to the bedside, you can determine how much more. So you can start putting gauze and your thing on there, but you determine how much more based on your assessment. Alright? Gloves. You know that you're gonna need gloves. You're gonna need solution for the dressing.
And remember, with everything, you check the date and
Then use your tape. For the tape now, you can pre-prepare the tape. So what we do with the tape, we actually put it on the trolley, right? Put it one side on the trolley. So we cut with the scissors. If you don't have scissors, you can use blade.
Don't tear?
No, don't tear it. Because sometimes when you tear, it looks very untidy. And when you leave that bedside, you want to ensure that the patient look nice. Use a team, Somebody say what?
Use the teeth.
Absolutely not.
And you all should actually have a nurse's scissors.
And you take this on your assessment. You can add more if you want. So you have this on your trolley too. Alright? Alright, listen now, listen. I didn't see any bigger, nothing no bigger something. And your syringe. Alright. Now, you are going to go to the bedside. You're going to talk to your patient.
On the top shelf and the
Thank you. Alright, so you have your I couldn't find the larger one. So at this point now, students, you have pre-prepared your trolley. You see that? You have cleaned, you have pre-prepared. Now you know the patient that you're going to. So what you can do, you can pick the docket up or verify again. What you have when you go to the bedside though, you have to have your unsterile gloves, because what you're gonna do, you're gonna assess the wound, right? When you have that, you also have to have a little tray, to carry your gloves and these gauze that you're gonna use, and a piece of tape. Also at that time, you can also bring the garbage bin if you desire. If you don't bring it, then you have to put it on the trolley. What I recommend is that you bring it, because sometimes when you go at the bedside and you put your garbage bin there, you have to leave and then wash your hands and come back before you start, because remember you touch the garbage, right? So when you bring it at this point, yes, you still have to wash your hands, but at least you have not started your procedure yet, right? So you carry two, and then whatever dirty gauze you take off to look at the dressing, you can actually put it in the garbage bin right at that point, because you already have it at the bedside. I brought it at the bedside. Everybody get it? Yes. Alright, so what we now use for garbage even though we should have for every ward a nice rolling garbage, you can use your foot and kick it and it has wheels and you can move it. I only see one on Mayo Surgical ever. I must see another one. But what you do, because we still have to do our dressing, we makeshift the garbage bin. So what we use is a box, cardboard box, and we put a red hazard bag in the garbage bin. Unfortunately, we don't have that red bag in the lab, so I'm going to be using a black bag. Please remember that you should be using red bag.
Red.
So you make shift your garbage. So everything is prepared, alright? Take a little time to prepare yourself. So that's why it's nice to do it before you go to bedtime. Very small. Alright. One more thing you should have on your trolley is the container that you're going to put Savlon in. Right? Savlon. You have any Savlon box? I'm going to go for container. One more trolley. You don't have to take that one with you when you go initially to the bedside, but you bring your garbage alone. Everybody following me? Yes. So this is your Savlon that you will also place on the truck. Alright? Everybody get it? So you're pre-prepared. So you have this still on the ward, in the treatment room or in the room, wherever they provide you for preparing your trolley. Then you go to the bedside. When you go to the bedside and assess the wound now, and say, but wait, look like we need more gauze on the trolley, man. So when you come back to go back to the patient, to the procedure, you can add to it. Everybody get it? You can add to the trolley. And you also need an Inco pad, right? Also need an Inco pad. Any questions? Any questions?
Ready?
Right, so you see that it takes a little while to just get to this point, right? So you have to be patient and do your thing. Alright? Now,
No, only the difference.
Look in your That's Sarah. On Sarah. In the green box?
Depending on your assessment, you think that you need gone. You think you need gone if you're doing a barrier patient, definitely you have to have your PPEs, right? You're doing a dressing at the bedside, depending on how the wound is, it's based on your assessment. Everything is based on your assessment. I'm not going to penalize you for wearing a gown if you see based on your assessment that you need a gown. But you have to explain to me on the bedside why you're going up so and the patient can't see your face. Why you're going up so on the bedside for a suture. Yes, so just a line. Yeah, so you have to tell me. But I'm not going to stop you. And I'm not going to, you can defend yourself. Why you have to do that. Alright, now, when you are at this point now, you are going to talk to the patient. And then when I come back, I'm going to let you practice donning the sterile glove here. So I'm going to go up to this point, then we're going to come back and practice putting on the sterile, because we can't do anything else if we don't get that technique. Alright? But I'm just going to walk you through this part first, and then we'll go ahead and do that. Any questions? Alright. So we're going to the bedside now. We have our docket, have our little tray. Our patient is on bed 15. Kids, and you can't reconfirm. All right, everybody getting it?
Yes, sir.
All right. So this round, as I was saying earlier, I'm here to do your dressing. These are students who are going to be observing. Would you give them permission to do that? Yes, thank you. We're going to assess the wound, and we're going to, remember that doctor says you have this wound here and it has to heal, so we have to clean it, we have to dress it so it can be healed properly, or can heal properly for you. All right, you want to get out of the hospital? Wonderful, and we want you to get out too. All right, so you're going to work with us today? Great patient we have here. All right. Okay, so we have washed our hands, we have come, and then we're going to do should have a bedside. Set up all over here. All right. All right, so Miss Brown, we are going to look at the wound now, all right? All right, this is the one here. Okay, let me just prepare my tape first, because when you take off the old dressing, ladies and gentlemen, you have to replace it with a new one. Not totally anchoring it, just to put it on so it don't fall off and you don't expose the wound. But you shouldn't expose it more than 5 minutes, even though, so you haven't started the procedure yet, so you don't want this wound to be open all the time. You're going back to the trolley, you don't know what else you're gonna do for your trolley to come back and the wound is still open. You see that? So you have to put it. I will put on a clean dressing, because what we're going to be doing now, even though we are taking off the old one, we still want it not to get any bacteria in, so we replace it with a sterile, clean one. Everybody get it? It has to be sterile. It cannot be some gauze that you take up in the treatment room without this kind of protection. It has to be sealed, and you'll see that this dressing gauze or sterile gauze is indicated on it. All right? You see that?
Yes.
Right. All right, so you don't have to use the sterile gloves, because you're not going to touch the wound. Remember, we're just looking, and we're not going to be touching. And even when we're palpating peri-wound, so we're going around the wound. Everybody get it?
Yes, ma'am.
Right, so that we don't go inside the wound. If we start to go inside the wound, it is not going to be good. So we don't want to put on back the dirty dressing that we take off. So that is why we replace it. Everybody get it?
Yes, ma'am.
Wonderful. All right, so. Oh. The gloves.
Yes, miss. When you have on glove, it's very difficult to manipulate.
All right. Now, when you're touching it now, you have to take it from the tip. So listen. Right, sometimes it's very painful.
Yeah, at the ear.
Because a long time. So you start from the edges, you see that? Remember, and please pay attention on how I'm doing this, because remember that I'm not putting my fingers in the middle of the wound. I'm at the edges, right, the peri. So look at this now. When you take off the wound, take off the tape rather. Look at this, you see that? All right, so even if you had the sterile gloves on, how would I compromise the sterile gloves? I have my hands down, yes. Another thing, I'm touching. So you see why it doesn't, you don't really need the sterile? Because you're still gonna touch the wound. What you're not to do, I mean, I make that clear.
Not.
Do not touch inside the wound with your clean glove, your hands. This is not sterile. Right? So you notice how I take off the tape. May I make you think kid, you know? You see how that's strong? Because sometimes, unfortunately, it's we the nurses cause the patient wounds to become like this. Because we don't practice the technique correctly. We are the ones who are responsible for it. And it makes me feel very bad as a nurse. Because we should be promoting healing, not making them gone. Sure. All right.
Shake it off.
You're very passionate about this thing. I feel it. All right. So you move from the edges, class, my good class. Yes. Yeah, me love you, you know. But the only thing you might look is on the gauze to see how it presents on the gauze. Right, to look at the drainage. You don't need no more inspection. Just look at that, drop it. Alright? Because this shouldn't be exposed. So, when you're looking at the wound now, can you remind me what I'm looking for again?
The color.
Color. Size. Right? Edges of the wound. So, if we notice, these will be the edges here. You look for any signs of granulation, any signs of necrotic tissue, any sloughing, remember those terms, right? And also you look at the drainage. Look for any signs of infection, so swelling, redness, pain. Then when you're ready to palpate, because you're going to palpate, because sometimes you don't see the drainage, but sometimes as you touch the wound, you see it coming, oozing. So you have to determine if it's on palpation or it oozes when, you understand? So you look.
So miss when
Or when the person just said the naive.
Right, you see all of that. So listen. Worm and all.
so miss when you're palpating, you have to have something on the bed so you don't drain on the bed.
Right, yes, Incopal. But we can put the Incopal when we come back. But we don't want to present it because we've seen the ooze, we can't stop. So when we come back now, you can drain on the Incopal. So, listen now. When we start palpating, we're going to go around the peri wound. Any pain, Miss Brown?
Yes, miss.
Yes, nurse, you feel very tender. all right. I'm just assessing. All right, just give me a moment. I have to assess this because based on what you're telling me now, I have to see if it is healing and it still looks like it has some challenges. And you say you're having pain?
Yes,
How the pain feel? When I touch it or before I touch it? When you touch it, you feel like fire. All right. Okay. All right. That is why I'm here for you. Okay? So we're going to clean this up for you.
Okay.
All right. I'm going to look if the doctor has any medication for you. Is it paining you that you think you could tolerate the procedure, or I have to give you something for it? Right? I prefer one like a pain pill. You know? All right. So I'm going to do that for you. Okay? So we're going to advocate. So listen now. When we put on the gauze, See it here now? See it here now? See it here now?
Alright, just say there, miss.
Good. We just put it on here. You see?
Miss, I have a question. Yes, sir.
And we just put on the tape. We don't have to anchor it.
Because you'll be taking it
But take it off soon.
I've come because I'm going to be the devil's advocate this morning. Yes.
So,
With Mrs. Hines. Mrs. Hines.
mhm.
If not that, but I have a concern about that sterile gauze. If it is a case that you're going to take out sterile gauze to cover the wound, if it is a case that you can do it like that, so you don't touch the gauze and you wait like that in terms of putting on it. But
Instead of
my
touching with that.
because my query with Miss Harley still is putting the sterile gauze on the wound with a unsterile glove.
That's what I was.
Yeah, but that was already established.
Mhm.
When I put it on with the unsterile glove,
Mhm.
we don't touch the wound.
Mhm.
We don't touch the wound.
The
But-
issue they are going to have, Miss Harley, do you disagree with me? The issue they're going to have too is the type of gauze that they're going to encounter at hospital.
We're not gonna have this.
No.
I have
We're not
an
gonna have
example
no.
of what they will say.
That is
Hold on,
why.
hold
That
on.
is why.
And the second question I wanted to ask, because I asked Miss Harley, because I said, I don't want there to be a change and an adjustment, and my mind is elsewhere. When you're taking off the gauze and they have layers of gauze, is it that I no longer leave a layer of the gauze on it, and
No, we
after
don't
I
leave
lift
it.
it, we don't leave it?
We
so
don't
you see,
leave it
that is
because
something we need to
That
clarify.
gauze is dirty.
So,
All the dirty
so
gauze. because
when
listen,
we are doing dressings now,
When-
we must take off
all the
everything.
gauze, right? When we don't take off the dirty, then we are going to still, when we expose the wound, whatever come in from the ear or whatever, plus what was dirty, we're going to be leaving on the wound. We can't leave that, right? Sometimes when we take off the gauze too, other little crust come off with it, like
From the skin.
other little crust. Or imagine you put that back on the wound, cannot work. The gauze that you see on the ward,
It's the one that is wrapped in the blue.
right? Thank you. Something like this. Something like this. So even though
But there
I
are
tear
other
this one
ways-
because I'm so used to this one because you actually have to tear it,
Yes, but there are
right?
sterile.
But listen, this is sterile, yes.
But they also say they
This is sterile. This is autoclaved and everything. This is sterile. But the thing is, when you do this, when you use this glove, and you know, as Mrs. Brian said, I have gone through all these questions. Our hands, because remember this glove is still not sterile. And why the glove couldn't sterile? Because we're touching all of these things. So it's still a compromise. Right? And another thing, when we open it like this, you see that? Open it like this. Take up the gauze from the edges. See how I hold it? Even how I hold at the edge, there's no way it will go in the way or the where the wound is. At the edge. Everybody see that?
Yes.
And then I just place it on. Alright? Place it on.
What if the wound is, the perimeter of the wound is bigger than the gauze?
Alright, so if if it's bigger, then you double the amount that you would put on
So
it.
Miss, that's why you end up with layers of
Right. So if you say, you say, whoa, you know, but you're not going to say wow over the patient. In your mind, you say, oh man, this was bigger than was expected. Because you have the pack of gauze. You see this?
But Miss, why I
Pack.
ask is because you would have still touched, you would have still contaminated the edges.
No, when you put it on there, because you're just putting it to the edges, it's not going to be on the wound, right? To the edges. Right?
What she's trying to say is that piece that you put down, it will take up all of it missing to the part that you touch me.
Well, if it does happen like that, what you have to do, you're still open enough, then guess what you do? See that? You see that? Everybody seeing? Still keeping to the edge. Sit here. Big enough.
That's all. That's the direction you have to put.
Then now, the only thing I have to adjust now is my tape. Because based on what I had calculated, it wasn't this big. So now I have to peel off more tape to anchor it. You don't want to make it stay like this because you don't know if the patient has.
And everything fly out.
Right? Yes.
This is just the covering before you do the actual.
Right, covering before you do the
You
actual.
don't need to worry about the bacteria because it takes that time for bacteria to start growing.
Right.
And then you have
When
to
it
clean
can
it.
transfer, it won't start growing. So it's
Yes.
just a couple seconds for you to go
Thank
check
you.
and come back with it.
Yes. Yes. It's not gonna go right there. But listen, you don't want any risk to your patient, right? So you're gonna do your responsibility as the nurse. Ensure that because sometimes when you go back to your trolley nurse, somebody call you or tell you something, somebody asks about the patient, then Nurse Harley, me have to go ask now because I can't find the gauze what I need. And then that take time. All this time the wound open. Can you imagine? And the worst thing about it is even worse because sometimes the patient don't even see the wound so up close and personal. Can you imagine I look on that all this time? Fly and everything, a picture and nurse gone. Right? So it's very important that you do this. Everybody get it? Very important, alright? So because our wound was not this big, I'm going to just take off this, alright, and remain. Why I put this little piece here of tape? Why didn't I tape it nice and
Because you're going to take it off again.
Right.
So Miss, when you taking it back off, it's the same way to put this one around the
No, that is another technicality. When you're taking it off, you would be sterile. Then, because we're doing the non-touch technique, you cannot touch with your hand at the far tip. Okay? Non-touch technique. Any questions? Any questions? Yes.
But me, since we use the unsterile gloves to put on those gloves, miss, how are we going to use sterile gloves to take off the unsterile?
No, we're not gonna put it. That we're gonna let you understand that. Remember when we're sterile, we're not supposed to go below our waist. So that can't work. So we have to use the forceps. But the technique of doing it, that's what you're gonna learn. Alright?
Yeah.
You're still going to be using the forceps and take it off. But guess what? You're going to be sterile, and whatever you use, you cannot use it back on the wound.
So when you use it, something take it off, you can't use it.
And that is why we set up our trolley. You can remember when I said that there's a container that has to have Savlon in there. Yes, that is what we will drop the forceps. That we take the gauze away or take it off and drop the forceps. So that forceps is not in our dressing process anymore. Normally you need 3 forceps. Some of the hospitals they only have 2. Only have 2 in there. Only have 2 in there. Only have 2. So if you have a situation like that, tell me some of the things how you could work out yourself. Only have 2 forceps in the set. How could you work out yourself? Thank you.
Someone assisting.
Assistance. Now once you sterile and you have 2 faucets. Thinking, ding dong, ding dong. What do I need to do? Right? Or
So the person
if
would
it
come
is,
with unsterile gloves?
so you could just yes, unsterile and just take it off for you.
Okay.
Or if you see that you have nobody to help you.
What's up with sterile?
That's a lot of work. Alright, the only thing that I could think of, and the ladies can help me, is if you have nobody to help you, and you're there and you only have 2 forceps in your set, and you have nobody to assist you to take off the old dressing, then you can still use one, but guess what? You would have to pre-prepare your gauze in the set before. So when you discard the first one, because once you touch that, you can't use it back in the procedure. You would have to know this would be still sterile. Take this one, move it to this hand, and because you had pre-prepared your gauze, you'd have to take them up with this hand and clean.
Okay.
Is this the one you're talking about?
No man, yeah, the forceps, yes. It's out of color. You miss it? Are you still aggressive?
Miss Eve, I'm not sure.
No, we will get to that. We'll get to that.
This one would always be sterile.
Yeah, we'll get to
sterile
that.
and to pick up the gauze.
Alright, so you see ladies, how I was stressing that this procedure is a kind of a bit of a technicality, long, and every year I have different questions from the same student. Some people, it's only the demonstration I can have. Because by the time the question is done at 2 o'clock. Yeah, because they need to get it, you understand? So we re-demonstrate another week. So if it's that is it, no problem, because I know that this procedure is not easy to get. Alright? Alright, so now when we're finished now, we're going to tell our patient that I'll be coming back to you, Miss Brown. This is just to keep the wound from getting anything on it, right? So when I come back, then we'll start the procedure. I'm carrying my students with me also. That's okay? Alright, thank you so much. You're such a wonderful patient. Alright. Put up your bed rails and you leave the patients, alright? Everybody get it? I start the procedure. I need to take off my garbage bin since it's still on my trolley. Take off my garbage and put it somewhere that I can handle, right? Take off my Savlon container. And then I would have to go and wash my hands, come back, and then start preparing. Everybody get that? Because I've touched the different things. Alright, so ladies, it's up to you now how to assess yourself, how you're going to use and be able to use your space. Right. Then I'm going to wash my hands and come back to the bedside. We'll be looking at my dressing set. Still look at the expiry date. So this one is expired on the 15th of the 11th, 2021. We have already... Yeah, that's expired on the 15th of the 11th, right? These black streaks here, this is to indicate that the set was autoclaved and sterilized. They also have an indicator inside, we don't have one in this one, but inside on the ward that you can actually verify, confirm to that it is sterilized. So you always look for that indicator, okay? Okay. Alright. If you see where there is any break in the dressing set in terms of tear, because some of the times you see that they actually use paper to wrap after the autoclave and sterilize it. any break, any tear, any damping to the dressing set, then this is definitely not a set to use. Because you can't determine if it's anything went in or something unsterile. It's not very good to use that set, all right? So you change the set, all right? Okay, then after you verify that, you are now going to so this is how the hydration fluids come. 0.9 don't have the straight 0.9, but I'm gonna use this one just to show you the thing. So I'm gonna tear here. See how we tear it off? And I'm gonna use up my pin, and then this I'm going to hang, all right? The height challenge, you know? All right. So then we have this ready. Then now, what I'm gonna do is I'm going to start opening up my sets, all right? And I want to rip this thing because I want to use it again. That work with me at all.
Yes, so why don't we just tear the tape? Like bring it from
Yeah,
the edge?
I'm tearing it because I didn't want to, but
Before it is trimmed from the edge.
yeah, but it giving that warm time, tearing everything.
So I'm going to do it.
All right. Then what you're gonna do when you open,
And this is why they have the sterile gloves on, right, miss?
no, we don't turn the gloves.
Oh.
Because remember we're touching the dressing set, so it wouldn't be on now. All right. Then we're going to open from the edges, right?
You should get that
No,
now.
you can't do that, no.
See it? See that? Right. Remember, this is sterile. You're not supposed to be too close to it, right? But you're still going to touch the inner layers, but the same technique of opening that I opened the outside layer. All right, so everybody getting it? At the edges.
I'm supposed to have some rusty one.
All right, so this is typically how the set would come. Well, I must not say that all the time you're gonna see a galley pot or emesis basin. Sometimes the tray comes in partitions, and sometimes it comes with one emesis basin and 2 forceps, as I said before.
Yes.
This was pre-prepared for the procedure, so I will have my 3 in here. All right. Okay. So when I have this here, I'm now going to. If you need to add any gauze now, this is where you do it. All right. Everything should be done in your preparation phase. So I don't need any gauze, but I'm just gonna add it for you to see how we open the gauze and add to the set. All right. Everybody following? So just as this says peel And I did show you the other way that we use the other one that you normally see on the wards. You won't see these fancy ones. And you peel nicely. And you just let it drop, all right? You want to move it, don't move it and say, oh yeah. No, do not move it until you're sterile, because remember, all of this is sterile. So even if it's itching, you say, I really want to move this gauze, you have to move it when you are sterile. Your gloves are on, all right? Sterile gloves. Everybody getting it? Wonderful. Then, you are going to add your solution that we saw on the medical order for this patient to be cleaned with. So it said that we should clean her wound with 0.9 sodium chloride, all right? So, we're gonna use our syringe. You can use a bigger one, ladies, but we don't have the big one. But you can use a bigger one to make it come down fast and you can have enough fluid. But they have 20 cc's, 60 cc's, but sometimes, you know, time it's on the wall. They have to use the 10. All right. All right, so you see this one that we have already pre-prepared up here? We can aspirate the fluids from this. It's a new one, however, based on some hospital policies, we still wipe, even though we have just opened this one and we're the first one who's going to use it, we still wipe the opening that we're going to insert. So you would have your alcohol swab and wipe the area, all right? Because there was rationale behind it. It is exposed now and you have been hanging it, so you still wipe, right? So we're going to be wiping still. And the needle that you have, and ladies, you have to be very careful, and gentlemen, with this one now, because you can stick yourself if you're not careful. So you insert, right? And you aspirate. See that, ladies and gentlemen? All right, wonderful. You see that? And sometimes people even stick it and they stick it at the wrong place and something start to leak. Right, something start to leak. So what you need to do is not that happening. When we are now going to put it now, we have to decide which one we're going to use for our solution. So I've chosen my Gallipot, all right? So this is where I put my fluid. Everybody seen that? What do you notice when I am putting the fluid in?
You hold it.
Did I put it in there to touch it and everything? Okay. Did I move it with my finger to ensure that it balanced? Okay, all right. Good. But once you do all of that, it's not sterile anymore. One more time, depending on your assessment, ladies, and how you want to clean the wound, because remember that we have already assessed the wound, so we know exactly how much time we need to spend to clean this wound. Everybody get it? So you determine now how much fluid and solution you will need for the cleaning. That is not standardized, that is based on assessment. Everybody get it? Okay. Wonderful that you're following. Then you do this. Remember, ladies and gentlemen, don't let it splash. You notice how I'm taking my time. Might be trembling, you know, because of the age, you know. But, but if you spill and you mess up your set and you mess up outside, you contaminate your area. And you will be asked to restart the procedure. Alright? Alright, so I'm not going to put a lot in there. I just wanted you to see the technique. Alright, so any questions so far? Alright. Now, when you do pharmacology, and Nurse Harley will be the one who will be teaching you next year, you never recap like this, right? So what we need to do, if I had my third layer, I wouldn't have to go so low. But since I don't have the third one, I have to be very low. I put the cap back here, and then I
Then you what?
oops, don't leave me. Alright, and then
Oh, Miss, what that you do?
so
Oh,
just
you can just put the cap on it?
no,
Let me show them.
you have to bend because you're not supposed to recap like that. Right? Remember, no, it's not on the bed, you do it. That's why
Yes,
people
and the
want
low
to be
shell.
like that. So remember the hair.
Miss, what's the rationale behind
No,
this?
because if you recap like that, sometimes you'll prick yourself. Right? Because when you put it like this, sometimes you miss. Right? So you put it on the flat. But if we had the third layer, we would have to go so low, ladies. But because we go low, we recap like that, and we put it down there. All right? Everybody get it?
Yes, miss.
Alright, it's gone from here. And the next thing that we add is our sterile glove. Alright? Remember, our field is sterile, so we cannot put our hands in there. I hope everybody getting this concept by now, you know?
Yes,
Okay,
No hands in
in the
there.
past, I have seen some dynamics. Alright, now, we're gonna peel off. And what I always tell my students, do not put the glove too much in the set. Why? Put too much in the set. Why?
Stretch over.
Right, very good, excellent. Your hands stretch over, and then you have a high risk of touching the set with the hands. Not, and you don't done yet. So you know, so you have to stop. Hmm?
So when you open it, that you could have put it more over to your right.
Hmm?
Next place.
No man, I'm talking about when you put in the glove.
I'm saying, this set, you have the space there to done it.
So she said,
No man, he's gonna done it on in the set. Yeah. All right. So you put sterile to sterile. Oh, all right. You see that? Everybody saw that? All right, so when you do that now, if you have anything else to add, this is where you add it. If you're not adding anything else, what you do, because you have to wash your hands because you have touched all the equipment that you need for the procedure. So what we do is we recover the set.
Somebody.
Then you go and
Wash. I'm going to wash for too.
wash your hands. Same way that we opened when we initially opened. See that?
yes, miss.
Now we're gonna don our gloves. Now when we don our gloves, because we don't want to be touching anything. That is why I said put it to the edge. Can put it.
Professional.
Let's do it like it's nothing.
All right. Then now, listen. You notice how I'm putting my hands now?
Yes, miss.
Right. When I wave to them and I say hi, because I have to be in the position of sterility now. All right. So what I do now? Take this off because I don't need it. Drop.
That not miss, that I go drop on the floor.
Yeah, man, but it went to the garbage actually.
Hey.
So, then the forceps. No, I have some forceps challenges. I couldn't find the right thing. So, alright, these are the ones that normally give the students problems to manipulate.
Okay.
So what I do now, because we know that we're going to clean, if eyeglass I drop off.
Actually, let me know the back of our farm there.
Alright, so listen now. What I'm gonna do, each gauze that I'm gonna use, I'm gonna put it in the solution, ring it.
Watch out.
Oh, Jesus.
Close.
Technique.
No, not forgetting that.
Right, true.
Alright, next one. I'm just doing it one by one because I want you to see the technique, ladies. You don't have to put one by one in your solution, alright? But just want you to get it. And remember, you're sterile now, so you can touch everything in your field, alright? You have not, because once you
Just not
touch,
with the beer goes.
one hand become dirty hand. Check out the best.
You can see it.
Thank you. Yes, I can see them. One becomes dirty, and the one that remains in the set is clean, always clean. One that you touch the patient with to clean is dirty hand. Dirty hand must never go back in your sterile set. Everybody get that? Yes. Okay. Then
Man.
Ringing out the extra.
yeah, ringing on this one because you don't want it too wet because you're going to be wiping the ear. And you see where I'm packing it. So when I start the cleaning, I don't have to be doing this because I cannot put my dirty hand back in the sterile field. So this has to be done before you start cleaning.
Alright.
Everybody get it?
Yes, miss.
Okay.
You so let me get one.
Yeah, because I have seen. Yes, exactly.
No, say you
Thank
can't
you.
don't get it.
Thank you, nurse, because I have seen something. And this is the hardest part. Sometimes people can't manipulate the
Body nerves, body nerves.
Alright, so I'm gonna do one more because my fluids are drying up anyway. Drying up.
So, Miss, one end, and the
Yeah.
adjacent end, and you twirl, and then you go the opposite way.
Yeah, just for ringing. If it dry when you do it once, you don't have to do it. Yeah. And then you put in your. And when your gauze is wet, it will shrink, so it will be easier to manipulate when you're cleaning. Everybody get it? All right. Now, I actually have 4 sets in here. So what I'm gonna do, I'm gonna use a larger one and take off the old dressing.
And once you use that, you can go back to the extent.
So we do it
You're gonna see.
put you all this
And you put it on the lower shelf.
Notice how I tape the tape. I didn't tape all the tape the gauze. I didn't tape all of it.
Yes, so you hold the edge of the gauze and pull
So
back.
this is why. Because now I'm gonna grab the edge,
And pull back.
right?
Y'all go be looking for alone.
Let me tape it to my. Right.
Oh, drop all that patient here.
Watch me
drop.
Oh, bear with me.
Oh, bro, give me Jasmine.
That's how you drop your miss?
That's what the sunblock is there. Then I'm going to, remember, I cannot put this hand over here. So I have to bring whatever I have for it to it, not it to it. You understand? Why this thing come?
Open it, miss.
Remember, this is cleaning. I can touch everything in
Yeah,
here.
man, right about this
The
hand.
forceps, miss.
This is the dirty hand now.
So your dominant hand will become your...
Yeah, if you're left-handed, yes, what's the question? Can you touch it, you touch the patient. Right, so it's a terminology. Once you are cleaning or touching the patient with this hand, the dominant hand, most persons use. Some person who are left-handed will use the left hand, right hand use right hand. This is considered dirty, so this cannot go back to your sterile field. So you have to bring your forceps towards the hand. See that? Then you can touch anything in here when you want to this hand, because this hand is clean. Everybody getting it?
Yes, miss.
Sometimes I need we need to be ambidextrous.
All right, so now the cleaning from here. Everybody get it? Then we start with the cleanest part of the wound, which is always considered inside the wound as the cleanest part. One wipe. You see I just drop it? We never go down to the rubbish and make sure it go in the nice. I drop it because once your hands are below your waist, you are unsterile. You have contaminated your sterile field. Everybody get it?
Yes, miss.
Then suppose when you start scratching it, there you go.
Ask your colleague to scratch it. Ask your colleague to scratch it. Call Candice.
One scratch us.
One scratch and make sure it is correct to her where she must scratch. All right, towards the hands again. Please make note of this, ladies. Make sure you put your hands back to the safe zone, right?
This with the same forceps.
Remember, so this
This
cleaning. Yeah, this is the forceps we'll be using to clean. Right? So this forceps should never go like this. Should always be outside the field because it's the dirty hand. All right.
What if you're cleaning inside the wound and like 2/3 from the gauze is removed?
You continue clean till it comes out. All right.
So me say go one more guys.
So let me full up on my glass.
Solution. But you want more solution.
When you go inside the wound, so remember we start inside the wound, which is deemed as the cleanest part. No care how it looks, cleanest. Then we go peri-wound and we follow the size or the presentation of the wound. So I don't want people to be cleaning a circular wound straight. You clean it how it is appearing on the patient. Everybody get it?
So it's in the case where you have the maggots and the worm, when would you start cleaning?
Right, so the maggots now, you would have to start to take it out before you clean the wound. So remember now, when you have that, you would have to have more than one forceps. You still have your hand, one at your dirty hand, picking out until you're satisfied that you can't see no more. Then you'd have to.
So they have to change
drop.
the gloves again?
No, you don't have to change the gloves, but you have to drop.
When you assess it and if maggots are there, you put something.
Or, yeah, because if you assess it and the maggots are there, you have to pick it out, right? You have to have more than one forceps, so you would have to make a special dressing set for that procedure. Once you know that there's maggots in the wound, because you have to pick it out And then there are times you have to drop that forceps, because you can't use it clean again, and replace it with another one. All right? To clean. Yes.
Also, the first step that Mrs. Science did, right? Before you put the temporary thing over the wound gauze, you would
Assessment.
we use cooking oil at the surgical when I was there, right? However, they're not maggot powder.
Yes,
You
maggot
apply
powder.
to it first, so by the time you go back to the bedside with your dressing, they start floating.
They start
So
coming
the
up.
incontinent pad first,
Yes.
then this.
Right, so you have to put your incontinent pad there. So so you put it on it, because that will be harder to, that will be on the patient medication, Cardex. So you put it in your assessment phase, remember the initial phase that we do? And by the time you come back, all the maggots to your delight will be there for picking out. Alright? Right. So you pick, and you have to count them too. You have to count them because you have to document how much you pick out. So nurse Turner will have to know on the handover how much maggots came out of the foot. You have to count
One as they drop them.
2, 3.
They're in the thousands, so you probably can estimate.
Right.
Thousands.
Yes, that's true. That's true. That's true. Yeah,
But it's a small wound, you pick them out.
that's true.
Just something. I watched a video where a little girl said that mother thing here, the worst thing they don't know. And when they carried her to the hospital and the nurse assessed, there was a nurse there, Miss, as I said, critical thinking. She was the one that found out that it could be something like that. And what she did, they were putting
Yes.
no, it never smelled it. It didn't burst out already.
You don't smell it, but we smell it.
Okay. So what happened now, Miss, she said she tried to
Yeah,
put
you know,
bacon
maybe.
on it because she thought the maggots would, it's fresh eating, she thought the maggots would come up. But what really happened, she says the new flesh they want, so they kept going down. So then
yeah.
the next thing that she came up with, she put
I've had
some
that experience.
Vaseline over it and cover it
Yeah.
the entire thing. And each time she wipe off the Vaseline,
Yeah.
because they came up for here. So that
Yes,
is how, and she pick
I
up
get it.
plenty out of it, miss.
I've had it. Once they start, they realize that you're picking them up, they go down. Alright, so you start with the inside, then you go to the peri wound around, so one wipe. So we're following the pattern of this one, right? And we drop. You see that, ladies? Not up and down. And the last wipe would be the other side. One wipe. Oh, that's bleeding. Okay. And then you will use one gauze now to pat dry when you're finished, alright? Pat dry. Alright? Right, so when you do this now, some persons, if you have more than one forceps like I do in here, I could actually drop this forceps now, use another one for covering. Okay. If I had an extra one, because remember normally 2 or 3. So, don't have an extra one, you don't have. So, I will drop this one now. Or if you don't do that, you could have used this one and transfer it to this hand, right? But we're gonna fix this. Alright. Don't need so much, but I'm just making you get the technique. If you had a large wound, what you could do, alright? Remember the edges that I touch? Easier to manipulate the gauze, alright? Then when you finish covered now, you can the tape that you had prepared,
Their hands are dirty now.
Yeah, because you're touching now. And you can touch now because the wound is covered. Everybody get it?
Yes, miss.
And when I see my wounds, it has to be neat and tidy. Yeah, but I go on more tape. And I wasn't planning to put on so much gauze. I just wanted you to see. Tape get jagged. Alright. No.
It's over there.
Here's my tape. Too jagged, man.
Refuse it.
Nobody see me tape?
No, miss.
Yes, it was under the bottom.
You know, but it's just gone. And you got this side.
Looking at the tray.
So you want one more piece?
Yeah.
A little longer.
Coming.
Thank you. And you see, you could prepare another piece because your wound is covered, so you don't have to be worrying about contamination, right? Because your wound is covered now. You are safe to touch. This tape went wrong. Right. Don't worry, because these are some of the challenges that you will have when you're doing this procedure. Right?
Man.
Yeah. So don't worry if you're not getting the tape off or whatever. All of this come with practice. All of this come with preparation. Right? You prepare yourself for the inevitable. Just cut off this jagged area here. Get to the dexterity.
But dexterity.
Wow.
Here's another dexterity. Miss, what does dexterity mean?
Your
Technique.
technique and your competence in your technique. So just to show you, ladies and gentlemen, how you would take. So you don't have to use so much, but because I put more gauze than it was intended. Alright, so thank you so much, Miss Jasmine. We are finished. How are you feeling? Alright, how is the pain now? It's alright now? Oh, wonderful. Alright, so yes, so when you can come back, because I already took out my gloves, you can come back or you can make it stay, depending on if the patient had one there, or you can take it off from under her and come back. But when you're finished now, you would have to now wash your hands, put this set in the sluice room, right? So what I do sometimes, depending on what you use for your thing, you would actually put put on another glove to just take out the things them, because you have to wash them out. Not, fully for washing, but just clean them so they don't look dirty when the person comes to collect them for autoclaving. Because as the nurses, we don't want to make them feel like, we're not considering their jobs, right? So we take out our dirty gauze, we take out our things that we don't need. If we use a solution that stain the set, we can just rinse it out nicely and just put it down where they will come and collect. Alright? Fair enough, ladies? Yes, that is fair enough. And then we wipe back off our trolley for the next person. For the next person.
Miss, you're not the next nurse, but if you have another patient,
If you have another
patient to dress, that's what you need, the next person.
Because sometimes I think it's FS and Nurse Carly can tell you. It's one trolley. Surgical ward people on a surgical ward. One trolley. And most of the patient Nurse Burris has a dressing to be done. So you have to wait until nurse is finished before you can do your patient. I don't know what was the logistics behind getting one trolley for them.
What we do, sterilize
Oh, come here and wait for me to put down. Them slack bad.
Right.
If Andrew can donate, I'm donate.
So ladies, that's it. Any questions? All right.